Idiopathic pulmonary fibrosis is an absolutely devastating disease that affects people in sort of later middle age, so around 60 onwards. It affects more men than women, although women can get it. And essentially what happens is your normal air spaces starts to turn to scar tissue, and the air can no longer get from your lungs into your bloodstream. Although we have 2 clinically approved drugs for IPF now, neither of them can stop the disease, neither of them can reverse it. We know that there's a big genetic link, and in recent years there've been some really good studies looking at genetic traits in people who develop IPF. The Medical Research Foundation funded me to do a 3-year project trying to understand the role of a protein called ELK1 or ELK1 in idiopathic pulmonary fibrosis. So in a healthy lung cell, ELK1 is bound to the DNA and it stops the expression of a gene that can go on to promote fibrosis. In IPF, these patients had much lower levels of the protein, so it wasn't binding to the DNA because there was a lot less of it. And that caused this gene that we know is really important to promote scarring and fibrosis. I sometimes attend patient focus groups and things. They understand that knowing more about the biology of the disease is really, really important if the next generation of IPF patients are going to have a better prognosis going forwards. They know that very little can change in their lifetime, but vast majority feel very passionately about doing all that they can to help the next generation of people who are given this horrible diagnosis.